They speak of their brother, they beam.
Look, his face.
The man who brought them such joy.
Oh, a Merry Christmas.
Treated with such disregard by those meant to look after him. Eddie was learning disabled. He needed 24-hour care to eat, drink, take medication. In May 2023, he had a fall at his care home and was admitted to hospital. But the fall didn't kill him. A lack of care did. He was diabetic, but wasn't being fed enough. He had dysphagia, a choking condition. Yet nurses continuously gave him jelly, despite his medical notes stating it risked fluid on his lungs. It caused Eddie to develop aspiration pneumonia, a lung infection. But staff didn't notice, and he couldn't tell them.
He didn't understand what was happening. You could see that he was really ill. He didn't respond, he was semi-conscious, drowsy. My sister had wiped his mouth because it seemed there was something on his lips, and a whole paracetamol fell out. And then I said, what is this? He's drowsy, he could choke. It was neglect.
It was neglect.
There was a lack of understanding of his condition.
I totally agree. I think people didn't take the time to learn about him and understand what his needs were to keep him safe.
In July this year, a coroner ruled that Eddie died through neglect. His death was wholly avoidable.
Eddie was a bit of a lost voice.
I think they're the forgotten people. It is hard.
Tonight, the government published a long-delayed report into the deaths of people with learning disabilities. The latest data from 2023, the year Eddie died, shows the average age learning disabled people are dying in England is 62 and a half. That's barely changed since the previous year when it was just over 62. That's incredibly young compared to the general population, who on average live to 82 years of age. The gap is even bigger for learning disabled people from ethnic minority groups, who on average don't live to 57. Asian people with a learning disability die youngest of all. The average age of death is just over 43.
There's a number of reasons for those health inequalities. Late diagnosis being one of them, lower rates of screening being another, health systems being inaccessible or not communicating effectively with people with a learning disability. But it really is not acceptable. We're dealing with something as important as people dying early, and twice as many are considered to be avoidable.
Rahima is 28. She has a learning disability and cerebral palsy. She's cared for at home by her mum.
My name is Rahima Begum and I live in London.
And speaks through a computer, using her eyes to select letters on a screen, and tells me she fears every time she has to go to hospital.
One time a doctor was speaking to my sister and I was awake. He told her that she should contemplate letting me go because of my quality of life. This was so upsetting to hear because I was right there. I was invisible. Like I was not a person but a thing. The NHS is not built to look after people with a learning disability the way it needs to. Thank you for letting me take part today.
Rahima should not feel grateful to be heard. It should be her basic right.
Oh, what have we got in there then?
In reality, too many are ignored, and they have died when they should have lived.
Daniel, such a moving report. Look, these deaths are avoidable.
Yeah.
Yeah?
Yeah.
So why aren't they being avoided?
Well, the NHS England say that they're encouraged by the progress, and they say there is more to do. I think the progress has been painfully slow. These numbers are scandalous because there is nothing about having a learning disability that means you're physically more likely to die young. It's not a sickness. It's not an illness. It points, I think, to a lack of care, a lack of accommodation, a lack of consideration, just going that extra mile across different care settings. The condition that people are dying of, the conditions people are dying of, are completely treatable. Now, for that reason, 10 years ago, the government set up this annual report looking into the deaths of learning disabled people in detail. But sources who contribute to this report have told us that they are facing potential redundancies, that the decision by the government to abolish NHS England is causing real uncertainty. The government say they are committed to this report, but they haven't answered specifically the questions over the future of the report.
OK, Daniel Hewitt, thank you.